The United Counseling Service is Bennington County's agency designated by the state's Department of Mental Health to provide necessary services to area residents. Along with those mental health services, it provides many more, including Head Start, children's programs, and substance abuse programs, among others. One of its programs is known as Medication Assisted Treatment, or MAT. It's designed to meet the need for individuals with substance use disorders. The program has been available from its main headquarters building in Bennington on Ledge Hill Road, next to the Southwestern Vermont Medical Center. But starting on May 1st, it will also be available out of its Northshire office in Manchester. We met up with Ryan Murphy, the Director of Outpatient Mental Health and Substance Use Services at UCS, to learn more about it.
Sure. So the MAP program is a medicated assisted treatment program. So that's for individuals that are on, there's different drugs and alcohol that they're addicted to. And it's a way to wean off the substances that they're taking and to get into a program of recovery for themselves. UCS runs that program of recovery, so we would see a person come in from point of entry, which is a walk-in service from 8 to 5, Monday to Friday at our Ledge Hill site, or 8 to 4 at our Manchester site on Wednesdays. And they would come in, they would start the intake process with one of our workers, and then they would go from there and they would meet with the nurse practitioner and the case manager, review their history, and if appropriate, they would be accepted into the program. We've had a program down in Bennington for a little over a year now, and there's a few other programs in the area, but there is nothing past, there's one program in Arlington, and then there's nothing past that until Rutland. And then if we went east, there's nothing in the Northshire area until you hit Springfield or down into Brattleboro. So there's a huge proportion of people that are being underserved or not served. There's no access by buses to some of those communities. And it's difficult driving to those areas as well. From if you pick something like Londonderry or you pick something like Danby, it's a long ride up to Rutland or over to Springfield. So we decided to have an expansion offer in Manchester to serve individuals that just weren't able to get to the treatment that they needed.
So, if someone decides it's time for them to get some help to break out of an addiction pattern, whether it's alcohol or another drug, and they come here, what would happen? What would be the starting point? They would meet up with a counselor here and have a conversation?
If they were coming into the Manchester office, the first thing they would do is they would meet up with the receptionist, and they would say that they were here for an intake for MAT services. Then our case manager would come out and meet with them, have a brief conversation with them. We would book in an appointment with the nurse practitioner who's on site on Wednesdays, and they would go through the assessment process from there. And then, if appropriate, they would continue on into the program. And if not appropriate, and it was a lesser level of need, we also offer other substance use services, which we have groups and individual therapy that we can offer, and they might be referred on to that part of the program.
So would it be a case where they would need to come back here like sort of once a week or twice a week or more frequently, maybe?
It really depends on the individual's needs. So some individuals need to attend the pharmacy on a daily basis to get their medications, and they need to come back weekly for check-ins. Some individuals are at a point where they can get up to monthly medications, and they're coming back about once a month for check-ins, or once every 6 weeks. So it's really going to depend on the person and where they are in their journey.
So they get some sort of medication then to kill the craving for a substance of whatever it is they're struggling with?
So not just to kill the craving, some of it will be to actually help with withdrawal symptoms. So not just the cravings, but to help manage the withdrawal symptoms, to help come down off the drugs or alcohol that they're utilizing out in the community. And it also helps their body kind of stabilize back to kind of more normalcy point because of ingesting lots of unknown substances in the community, or even ingesting alcohol, which is a known substance, but the amount of kind of changes that makes to your physiology. So it helps them kind of wean back to a more healthy state. So it is a harm reduction method. I mean, the stark realities of some substances are that there is a significant risk to life with the idea of cold turkey. Alcohol, heroin, opioids, there can be a risk to life by trying to just go cold turkey. So medications can be required in some instances in order to save the person's life. The idea of if you were chronically drinking for an extended period of time, coming off of alcohol, that could be fatal. So you could go into a seizure, you could go into a coma, and you could die from that. So we don't want to see that happening to people. We want to see the right course of treatment. We want to see people having a successful course of treatment. Also, by just going cold turkey, it doesn't address the behaviors behind that. So the behaviors that lead one to use substances, they're not being addressed by just simply stopping, which means the cravings can continue and the urge to use will still be present. Yeah, and I think it's important to discuss not just opioids. I think it's important to be realistic about other substances in the community as well. We do have opioids which have a presence in the community, and I don't deny that, and it's a significant presence. And there is, unfortunately, a trend that has increased over the last 10 years of overdoses. But I think it's also important to kind of throw out some stats around that. So in the substance use program that I oversee, roughly 55% of all individuals that come in are for alcohol treatment. The next biggest drug that we're probably seeing is those using crack cocaine, and then opioids after that. So I don't want to lose sight of some of those numbers. I think those are very important. I think there is a general stigma still around alcohol being a legal drug, so it doesn't come with the same problems. And I think people who suffer from addictions, it doesn't really matter what the drug of choice is. It's just the impact on their life. And I think we see that more as well. And roughly 4 out of 5 hospitalizations that have to do with substances for detox and withdrawals at SVMC are alcohol related. So the numbers would tell us that there's a lot more concerns with alcohol. And then the data that we're seeing is probably crack cocaine is the next number and opioids after that, which doesn't deny that there is still quite a concern around opioids. But I think it's also very important to highlight that that's not the only thing that we focus on. I think it's just important to say that we are here to meet people where they are at, and to give the support to people for kind of where they're at in their journey. There's no judgments by walking into the door. There's no judgments for how long, how short you've been using, what your cravings are, anything along those lines. We're here for you, even if you go back into the community and continue to use. We want to be a steady presence within this community. We want to be here for folks that need the services.
Again, appointments can be made at the UCS office in Bennington on Mondays through Fridays, and at the Northshire office in Manchester on Wednesdays. For more information, visit the United Counseling Service website at ucsvt.org or call its Northshire office at 802-362-3950. For the GNAT-TV News Project, I'm Andrew McKeever.